Why are TB patients isolated in healthcare facilities? Imagine a person with active tuberculosis coughing in a hospital room. The tiny droplets they releases can float in the air for hours, carrying bacteria that cause TB. This is why isolation is so important. Tuberculosis is an airborne disease caused by the bacteria Mycobacterium tuberculosis. When someone with active pulmonary TB coughs, sneezes, or even talks, they releases tiny infectious particles called droplet nuclei into the air. These particles can stay suspended and infectious for a long time, making it easy for others to breathe them in and become infected. To prevent this, healthcare facilities use special isolation rooms. These rooms often have negative pressure ventilation systems. Negative pressure means air flows into the room but not out, so the bacteria stay contained. This setup helps stop the bacteria from spreading to other parts of the hospital and to other patients, staff, or visitors. It's a key part of infection control, especially in busy hospitals where many vulnerable people are treated. Another reason for isolating TB patients is to protect those with weakened immune systems. People living with HIV, the elderly, or patients with other chronic illnesses are at higher risk of developing active TB if exposed. By isolating infectious patients, hospitals reduce the chance of these vulnerable groups catching TB and developing serious illness. Drug-resistant TB strains, like multi-drug-resistant or extensively drug-resistant TB, are even more concerning. These strains are harder to treat and pose a greater risk of spreading. Isolating patients with resistant TB strains helps prevent transmission of these more dangerous bacteria. Public health guidelines often requiring that patients stay in isolation until they are no longer infectious. This is usually confirmed by microbiological tests showing negative sputum samples taken over several days, after at least 2 weeks of proper treatment. Alongside isolation, healthcare workers wear masks and follow strict respiratory hygiene procedures. Patients are taught to cover their mouths when coughing and may wear surgical masks outside their rooms. These combined measures help reduce the risk of airborne spread. While isolation is vital for controlling TB, it must be done humanely. Overly restrictive or poorly managed isolation can cause emotional distress or discourage people from seeking care. Healthcare facilities aim to balance infection control with compassionate treatment, ensuring patients feel safe and respected. In summary, isolating TB patients in healthcare settings is a crucial step to stop the bacteria from spreading through the air. It protects other patients, staff, and the community, especially when dealing with drug-resistant strains. Proper isolation, combined with protective equipment and good hygiene practices, forms the backbone of effective TB infection control programs. Always remember, if you or someone you know is being treated for TB, following medical advice and public health guidelines is essential for everyone's safety.